My view of homelessness years ago was one of contempt. I kept looking at these people on the street and I said, you know, pick yourself up, do something with your life. And I always had it that it was out there. It was like they were able to be in control of their life. And I looked, I said, I'm in control of my life. I'm responsible for my actions or my inactions. So why can't they, instead of begging and asking for money, go and get educated and get a job? And then every now and then, I reached into my pocket and I pulled out my wallet and I gave them $1. And literally one day when I was reaching into my wallet to give them $1, there was my business card. And I go, wow, I got an idea. If you're really interested in not being homeless, here's my card. Show me that you're willing to meet me halfway by coming in off the street and allowing me to fix your teeth and get you out of pain and give you some dentures so you could smile again. For those who really just had, a turn of bad luck or fortune and just needed a little extra help, maybe I could be the conduit for it. So now my view is that there are quite a few people that are not there by choice.
On some level, yeah, there are people who choose it. I would submit, however, that most people, when they get to the streets and have been there a week or two, if even that long, are shocked at what they experience and find. It's really dangerous, it's unhealthy, it's lonely, it's really destructive, and I think people find that out far too quickly and in ways they hadn't anticipated. So where people may choose initially, I don't think in the long term it's a choice.
For whatever reason, mentally, physically, or maybe it was an emotional trauma, whatever brought them there. None of that matters. You can look at all those reasons, but you're just wasting time when you can actually start contributing in the aspect of giving to solve the problem.
The average homeless patient that comes in has gum disease. The vast majority of them have teeth that I just can't salvage. They're just either broken or rotted away or abscessed, and I literally can't salvage them. So I need surgeons because I need to have them extracted. And then once the teeth are extracted and healed, the most common procedure is to give them a removable appliance, or what we call a denture.
They put a wax, I guess they take so they can get a print of the roof of your mouth and the whole gap of teeth are missing, and then they made a plate and they fixed it so I can smile again. It gave me a little bit of confidence so I can go back and try and get some work. You don't want to smile really. You want to keep your lips shut when you're talking to someone if you don't have any teeth there.
When you're somebody who doesn't have teeth and malnourished and malkempt, you have a certain appearance, your whole face looks sunken. It permeates everything. It permeates their social life, their family lives. It's not just about restoring somebody's teeth. Like I said, it's about making a barter. It's about having somebody step up to their humanity and their dignity again.
When Homeless Not Toothless started, I partnered up with the Venice Family Clinic. So the Venice Family Clinic did my screenings. They were actually doing the steps to make sure that they were healthy enough to be seen in a private practice, that they were mentally stable enough to be integrated with my patients, and they did their own screening process to actually determine whether or not they fit into the program, whether they have inadequate funds, whether they're living on the street, they're living in a shelter. From that, it's morphed, and since we've seen well over 1,000 people, all of the clinics and shelters in West Los Angeles refer to us. And what I request when they call is that they actually send the patients through Venice Family Clinic so they get medically cleared. Then I partnered up with Chrysalis. Now, Chrysalis is this wonderful nonprofit here in Santa Monica, and they have a job placement program. But the wonderful part is, not only is it free, because it's a nonprofit, they have a 92% job placement rate. And if they don't have a job available for what your skill set is, they'll teach you. They'll train you. And this is absolutely perfect.
Chrysalis teaches workshops on resume preparation, how to fill out an application, interviewing skills, goal planning, money management, as well as having on-site practice interviews and personalized case management. Chrysalis has a computer lab We have a clothing room for people who are going on interviews or going to work. We have phone bank so people can make phone calls to employers and they can also receive phone calls. So we have a message phone number. So if they don't have a phone number, they can use ours. We are offering a hand up, not a handout, meaning that we, at our facility, we're not handing jobs to people. We're not job developers. We are helping people gain the skills to go out and get jobs on their own. In most cases, people who are homeless, who are low income, even if they're working, they often do not have access to health care unless it's for an emergency issue. So a program like Homeless Not Toothless really makes that bridge from somebody who does not have an urgent problem but really needs to have their teeth fixed, but there's really no resources out there for them.
So I think what stops the homeless from getting dental care is access, the knowledge of who's able to treat them, the limited dentists that are in town that are willing to volunteer their services, and fear. I've certainly seen quite a few people who are embarrassed. They're embarrassed about their circumstance. They're embarrassed about not being able to take care of their teeth for such a long time.
It works on your self-confidence. You know, you don't want to smile. So that's, I think a smile is like 90% of the presentation.
See, there's a lot of things that are affected by teeth. Your health itself is affected, so you're going to be sick a lot. Don't look good, and you don't speak too well.
There are a lot of stereotypes that when somebody is homeless, we think of the aged granny or grandpa. A lot of times it's connected to age. Often it is attached rather to class. We'll look at somebody who's missing back teeth, they must be homeless. Oh, they must be from a lower class of person. Oh, they must have suffered a lot of hardship. So for somebody who's trying to succeed in life and doesn't have teeth, we have a lot of preconceived notions the minute somebody opens their mouth and there's a gaping smile there.
I think for someone who has no teeth or is missing a lot of their front teeth, they could have all of their other ducks in a row, but that could be a major barrier to them finding work.
You'd be surprised, the homeless people. There are a lot of professionals, a lot of people with degrees, a lot of people that, I know lawyers that were on the street, so it's not just a select group that can end up there. It could be you, me, anybody. When I had my heart attack 3 years ago, that's what actually brought me to the Homeless Not Toothless program.
John had 3 months of sobriety. He didn't look so good. I don't think there were any teeth I could save at that point. I mean, he was really going through like a lot. He said, I had an interesting experience 3 months ago because I had a heart attack. And I'm lying in the ER, and the doctor comes up to me and pulls out a syringe. He goes, you know what this is? This could save your life. He goes, give it to me. He said, why? Why should I waste it? It's a county facility. I've got a limited supply. So why should I save your life? He said, the reason you're having a heart attack is from your drug use. I'm going to save your life. You're going to go out and use again. You're going to have a massive heart attack. It's going to be an absolute waste. And John said in that moment, he got that he had an opportunity to choose powerfully life or death. And it literally was a life and death moment for him. And he paused and he looked at the doctor and he says, listen, I bet you hear this a lot, especially at this county facility, but I swear to God, I'm done using drugs. The doctor says, I'm going to hold you to it. It saved his life.
Straight from the hospital, I didn't even go home. I just went from the hospital down to the rehab. You have to be active for a change to take place. So sitting down there, if you're homeless and waiting for a miracle, you'll be waiting for a miracle for a long time.
All you have to do is show up. And I'd say that's 99% of the problem right there. Once you show up, you're going to be just so glad you did. Anyone that is hesitant to find out more about this Homeless Not Toothless program, you owe it to yourself and to the rest of your family and all your rest of your days on the planet to investigate a 2-minute phone call, because it's just going to change your life. You're going to be happy again. You're going to feel self-confidence. You're going to feel that I can go do it, and nothing can hold me back now because I have a smile, and I'm not handicapped without that smile.
The difference that Homeless Not Toothless is making is giving people an essential part of their self-esteem. And one may not think that you know, that fixing somebody's teeth is going to make that big of a difference, but it makes a huge difference. It really affects somebody's inner core confidence and a sense of who they can be to the world.
When patients walk out, what we're seeing is just joy and excitement, and literally we see the possibility of who they could become because they now have had this huge step forward in their health care, that they're empowered. And that's what we're looking for. We're looking to have patients become self-empowered so they have the confidence to go out and actually look for jobs and start being social again and literally not being on the street anymore.
I just wanted to hug the guy and jump up and down and do cartwheels all over the place. I was so happy. It was just like night and day. I was, you know, from a few months before that, before I ever met him or heard of him, you know, what am I going to do to like, all right, now I can go and get a job and, you know, get my life together and, you know, get on the right page.
Right now I'm full-time working, being able to have Jay with his support in many areas. It's affected my life in all aspects of my life, not just my homelessness or my drug abuse or anything else, but it gave me a belief again that people make a difference.
I look at as Homeless Not Toothless as actually a solution. If I could get them off the street and empower them and give them the smile so they could get a job and get them out of pain and build up their self-esteem and get them sober and put them into a job placement program, now they're saying to themselves, I did this. And if they had a little help along the way, so be it. We've all needed a little help along the way. So that's what Homeless Not Toothless is doing, contributing to society. It's breaking the cycle of homelessness. The more people you have supporting your cause and rooting for you, the better impact you could have. Whichever way the boat is going is not as important to me as who's on the boat. Because I got that we could keep navigating through waters in different directions, and as long as the right people are on the team, we're going to achieve miraculous things. What the medical profession can do is contribute a small percentage of their time. What individuals could do is contribute financially to the vast number of organizations that are out there, including Homeless Not Toothless, to help pay the lab costs. That all makes a difference.
Homeless Not Toothless is about creating community awareness, community conscience, and community involvement. It's not about waiting for the government to step in or waiting for the city to step in and make a difference. We have the opportunity to make the difference.
So as a group, as a community, we could all collectively contribute to the homeless so we could actually declare the end of homelessness. Several years ago, a law was passed that requires every child in the foster care system to have yearly dental exams. The problem is there's no money.
To think of children dealing with the same suffering in many ways that these homeless people have, it seems like the next natural piece.
So we've got a new project that we've started where we are building a dental clinic that will treat 28,000 foster children. This is a huge project. You know, 28,000 people is a moderate-sized town. It's a lot of people to take care of. And I can't do that with volunteers. This is going to be, a full-time, fully staffed clinic.